If you clicked on this video, there's a good chance you're worried about falling as you get older, and for good reason. Studies show that 1 out of every 4 seniors will fall every year, and 300,000 of those falls could result in hip fractures, which could lead to severe dysfunction or possibly even death for many people as they get older. But there's good news. We're going to go over 5 reasons that seniors would fall and ways that you can prevent those things from happening so that you can prevent yourself from falling. Now, the first and possibly most obvious reason is loss of balance. Now, as we get older, we tend to lose our balance more often than not. There's 2 big reasons for that. One is vestibular function, which is fancy words for knowing where your body is in space. Basically, if you can think about a gymnast who can flip around a bunch of times and land perfectly on their feet, as we get older, the system that allows us to know where our body is in space and then land where we want to gets worse and worse, and just taking a few steps can lead us to toppling over. But there's a way to train it. Also, losing your muscle control, as in getting weaker, happens at a rapidly increasing pace as we get older. So, first thing we can do is some balance training to help prevent this in a number of different ways. So let's go over 3 balance exercises that you can do at home that are progressively harder, but also work your balance more. And these will be your foundation. Now, I also recommend that if you're going to do these, make sure that you have supervision. Because we're working on your balance, we're naturally challenging it. So there is the possibility that you have a fall. But in order to prevent that, we, 1, want someone there with you, and 2, have support near us. So they say this is your kitchen counter, something that you can grab onto quickly so that you do not fall. Now, the first exercise, all you're going to do is just stand with your feet perfectly close together, right? This is the lowest level. This is the easiest balance exercise that we want to start doing. Facing our counter, we're going to stand with our feet together, and we're just going to try to keep good posture, right? So try to notice, are you swaying a lot or are you staying very centered? If this is really easy for you, one way to train that vestibular system is to do the same thing, but close your eyes, again, right by your counter support. Try to let go, see if you sway. Ideally, have that person who's supervising you right by you, just in case, again, but we are trying to prevent falls, not cause them. So you're going to hold this for about 20 to 30 seconds, as long as you're not actively losing your balance, and then repeat it for 3 times every day. That will work on that vestibular system that we tend to lose as we age. The next exercise we will do is a little bit harder, and you're going to stand with one foot in front of the other as if you were going to do a DUI walk or a tandem walk. So it looks like this, right? Now, same idea. We're going to stand in front of our counter here with our support. Start with your hands on the counter, put one foot in front of the other, and you're just going to try and hold this position for 30 seconds. Obviously, to challenge your balance, we want to try to take away the support once you're ready, holding for 30 seconds. If you need to, you can have one hand with 2 fingers there just for that little bit, but you're trying to take that away so that you can work your balance. Then you'll repeat on the other side, again with a goal of 30 seconds. If you're wobbling a little bit, but not falling, that tells me we're challenging your balance enough to actually make it progressive and get better. Do this 3 times on each side, 30 seconds each time, every day. Finally, our last balance exercise is single leg balance. Simple as that. Simple, maybe not easy, but trying to hold for 30 seconds, 3 times on each leg. Again, by your counter support, 30 seconds. Now, again, if you're wobbling, put the foot down, pick it right back up, try to go for that 30 seconds, and your goal is to go for 30 seconds unbroken, as in you don't use the support or you don't put your foot down, and that'll tell you that you're really getting better with your balance. This may be difficult for a lot of people, especially as we get older, but do the best you can and start slow and easy. The second most common reason that people fall is lower body weakness. So we're going to especially focus on 3 different muscles, which are the quads, the glutes, and the calves. Now, reason for these are your biggest stability lower body muscles. So we're going to go over 3 exercises that you can do to help strengthen these. Now, the first exercise we'll go over will primarily focus on the quad muscles in your thigh, but the good news is, at least with 2 of these exercises, you will have some crossover and be able to strengthen multiple muscles with 1 exercise. So this is going to be the most simple exercise, doesn't necessarily mean easy, but from any chair that you can, you're going to work on sit to stand. So all I'm going to do here is simply stand up. Now, to make this an exercise, I'm going to work on my control. So I'm going to slowly and controlled lower myself down to the chair, come back up. I might work my way down to lower and lower chairs at my house. If you need to, you can start off with armrests so that your arms can support you. But what I recommend is working your way to taking those armrests away and really focusing on working the legs so that your arms aren't helping you, right? Pushing up, standing all the way up, and slowly and controlled lowering myself down. I'll repeat this for 3 sets of 10 repetitions to build my strength. So I'll do 10, I'll take a break, about a minute or 2, and then do 10 again, take a minute or 2 break, and then do 10 again every day. The second exercise will work our calves, and this is as simple as calf raises or heel raises, where you can hold on to the counter at the kitchen. Go, if you really want to, you can use your first step of your staircase with railings to hold on to, and you're going to raise up onto your toes. Simple as that. Again, with control as you go down, shooting for 3 sets of 10, and you want to feel a nice burn in your calf muscles as you're doing this. The third exercise will primarily work the glutes, but we'll also get some quad work in there too. You can do this laying down in your bed, on the floor, wherever you can comfortably get to as a flat surface. You're going to lay down on your back. You're going to bend your knees evenly. The more bend I have in my knee, the more emphasis it will place on my glutes. So if I straighten them out, it will put more emphasis on the back of my thigh muscle, my hamstrings here. So try to have a good amount of bend in your knees. And I'm going to raise my butt towards the ceiling, just like so. I might add a little bit of a squeeze at the top just to get a little extra work out of my butt muscle and activate it further. But I'm just going back and forth here for 3 sets of 10. Every day I'll do this, and that will be my foundation to help me build some strength in my legs. Now, if you already are relatively strong, you can definitely progress these exercises with weights or bands, anything that feels appropriate for you based on your current fitness level. The third reason that most seniors will fall is based on medication interactions and side effects. So common culprits include blood pressure medications, sleep aids, or pain medication, all depending on what you're on. So the first thing I'll recommend is that you consult with your doctor to actually make sure you're reviewing your medications, seeing if you need to come off of any, go on new ones, or change the dosage of ones that you're already on. And the second recommendation that I have is that if you're on a medication that changes something like your blood pressure or your blood sugar, that you're monitoring whatever it's supposed to be changing daily, if not multiple times a day. So if you have a blood pressure cuff, there are plenty of automatic blood pressure cuffs that you can use to check your blood pressure daily, if not twice a day, to make sure you're within a normal range. Because even if you're on medication for it, you can still be too high or too low. Now, the too low is oftentimes the culprit for blood pressure, where all of a sudden you stand up, the blood rushes from gravity, and you lose your balance or sometimes even lose consciousness and fall to the ground. So that's what we want to avoid. Definitely make sure that you are monitoring any medication and the after effects of that medication to make sure that whatever it's supposed to change is within a normal range. The fourth reason a lot of seniors fall is due to poor vision or poor lighting, which a lot of falls tend to happen at night when people are getting up to use the bathroom. So one thing I could recommend is using night lights or having a flashlight by your desk bed so that you can safely and comfortably make your way to whatever room you're trying to get through when the light is poor. And the fifth reason that most seniors will fall is due to clutter or obstacles in the home that may be unsuspecting that cause them to trip and fall. One of the most common that I see that is the most unsuspecting is loose rugs in the home. When all of a sudden you're not thinking about it, you might be carrying something and you trip on that rug and it causes you to fall because you're not able to react quick enough to catch yourself or pick yourself back up. So I've only had one patient that I've ever had actually fall due to a rug. That's one patient too many, and I really wish that every time I go into a patient's home that they will pick up their loose rugs to prevent them from falling, because it's such an easy thing you can do to make sure that a catastrophe doesn't happen. I hope that was helpful for you. My name is Ganzer. I'm a doctor of physical therapy. If you're looking for more ways to prevent falls, check out this video I've made on balance exercises to help you prevent falls.